Welcome to my channel. My name is Tina. I am a Nigerian UK registered midwife. I started my journey as a midwife in Nigeria, wrote my exams and got registered. Then I migrated to the United Kingdom, wrote my Midwifery OSCE examination, got licensed and registered to practice as a midwife in the UK. So I'm so excited to be sharing this journey with you guys, and I'm so happy to talk about this very crucial aspect of midwifery education, which is the Midwifery OSCE. OSCE stands for Objective Structured Clinical Examination, and is a very important examination that you need to write before you can get registered in the United Kingdom. It is only done in the United Kingdom. So, and what you need to do is, if you're already in the United Kingdom and you are working under a trust, it's a bit easier because normally trusts register the exams for you. But if you're self-sponsoring, then you need to do everything all by yourself. What you need to do is just go to the NMC website, then you register under the Midwifery OSCE bit. Then it shows you what you need to do to register. The exam is £794. And if you fail the exam once, 7 or less, then you need to pay half of the amount, which is £394. And if you fail 7, or if you fail more than 7 stations, then you need to pay the full fee. Hopefully no one fails more than 7. And before you can retake the examination, you need to wait 10 days before you can actually retake the examination. And I think 3 attempts to write the examination. After the 3rd attempt, then the NMC needs to review your application, do some other things. I don't know about that. So what we're going to be talking about today, I'm just going to be talking through the basics of Midwifery OSCE. So the exam can be written in 5 centers, 5 different centers in the United Kingdom, which is Ulster, Oxford Brookes, Northampton, Northumbria, Leeds University. So if you're trying to book your exam, try to consider where is closest to you, so you don't have to start traveling too far to write your examination. And I wish you the best in registering for your examination. So on the NMC website, when you register for your examination, the NMC has provided very good materials for you to use to prepare for your examination. The most important thing I think worked for me on the NMC website is the marking criteria. This, you can print out a hard copy like this, or if you want to download a soft copy you can just reach on your phone and you can do that. But it's very important because the marking criteria is just like a very good guide. It's going to guide you through everything you need to do in each station on the OSCE. So it gives you like a template of what you need to do in each station, and it's going to really help you, because it really helped me. They're not going to mark you outside of the marking criteria. So if you follow what is on the marking criteria, I think you're good to go. So let's go into the business of today. The NMC OSCE is divided into 10 stations. So the first 4 stations is the API. And this is like what most people struggle with while preparing for the examination. And the API station is assessment, planning, implementation, and evaluation. In this station is 20 minutes for assessment. Yes. And what you're doing in the API station is you're assessing your lady. A lady comes in with complaints, tell you this, blah, 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 blah. You assess this lady, do some observations, try to know, okay, what is wrong. Like with your examination, you can actually make a differential diagnosis of what is actually wrong with the patient. The planning part is where you're going to write down what you've done in your assessment. So it's just like a written station. You're going to write down what you have done in your assessment. You write it down, make a plan. And the implementation is, what you're doing basically in implementation is administering medication. Okay, this lady has come in with headache. You've done a urine. She's having maybe 2-3 pluses of protein and all of that. You've palpated this pregnant woman and done everything, checked her, came up with a differential diagnosis, you wrote your plan, and maybe the doctor has seen her and prescribed maybe paracetamol and labetalol, or maybe, I don't know, just anything. What you're doing in implementation is you're administering medication to the patient. It can either be oral medication or intramuscular injection. So you're administering medication in your implementation station, and your evaluation is everything you've done from your assessment planning, implementation. You're handing it over to the next midwife. So it's like it's linked. The stations are linked. It's a linked station. Assessment, planning, implementation, and evaluation, handing over everything you have done so the care of the patient can continue. And we have the clinical skills station. We have about 10 skills, and you're going to be given just 4 stations out of like all of the plenty stations. We have the normal birth scenario, we have a shoulder dystocia, removal of urinary catheter, IV flush or VIP scoring, PPH, postpartum hemorrhage, postnatal check, sepsis. Yeah, those are the stations we have. So you can either have any of these stations, but you haven't 4 of them. Then the last 2 stations are written stations as well: the evidence-based station and the professional value station. For the evidence-based station, you can either have induction of labor or place of birth. So they just give you like an article and tell you to like give you article with values and tell you and just how can you use these articles also in planning care for the patient and also educating the patient. While the place of birth, we have different places of birth in the United Kingdom. So you're going to also like talk to patient and try to know what kind of place of birth the patient has decided to go with for their delivery. And for the professional values, you can either have safeguarding or bereavement. So they give you like a scenario of you went for home visit and a lady, and maybe you saw maybe the baby has bruises, anything like that. They can give you any safeguarding scenario, and it's also a written station. You just write what you think you're going to do for the patient. And the bereavement bit is they are just trying to assess how you care for a parent, like a woman or a family who have just lost their baby, have miscarriages or anything like that. That's just what the bereavement bit is about. So the 10 stations, they're going to assess you like that. Under the API, you can either have antenatal, intrapartum, or postnatal. So you can have any of these 3, but you must have assessment plan, implementation, and evaluation for any of them. So this is basically what the 10 stations of the Midwifery OSCE is about. In my next video, we're going to talk deeply and focus more on API. And I believe while getting on along the video, we're going to understand what Midwifery OSCE is about. So guys, if you've watched this video to this level, please kindly like, comment, subscribe, share my video. See you guys in my next video. Thank you. Bye.